my interest has been always pharmaceutical economics, trying to help patient access, healthcare. My passion is about also working with people, especially, the underrepresented populations. I really believe, equity should be at the center of, healthcare decision making. I wasn't trained, during my doctoral degree to do the patient preference and stuff. I learned after that because I thought that, well, you know what, I am interested in talking with patients, and I have passion on that. So and then I go, look and see what kind of methodology or how, in terms of the research, how can I do that, or how can I help, people, or how can I incorporate, their voices, into my world, or my, the value assessment and that kind of stuff. The majority of the studies, okay, when we determine or assess the value, based on patient preference, we would ask people or patients, to think about what kind of treatment would they prefer. I like to incorporate the equity concern when I determine the patient preference, and when they look at the efficiency. Efficiency mean the benefits and the cost and the risk and those kind of stuff, and see how is that would affect their preferences. People really like to help each other, and I really think that equity would have an impact on what they actually choose or value. So if I ask them, hey, what would you feel, or would you still prefer the same kind of treatments, or, the treatment characteristics? If indeed, I put the equity concern, if my idea or my thoughts were correct, so that means people would, compromise, accept the a little bit, kind of lower benefits and higher risk in order to, free up the resources, for those people who, are in need. So then I can show the, to the stakeholders or the policymaker, hey, that is what people, that's what people do, people think, so what do you think, when you develop the, the coverage, or, the for the treatments or anything like that, can you actually take that, equity, into consideration? To incorporate the equity into the value assessment, it is challenging. It's an interesting area, but it is very challenging. So what I meant by that is like, because in the economic world, okay, so we focus so much on the efficiency, how should we spend money, wisely, or anything like that. Equity is almost like an enemy of the efficiency, if you may. So, so with that, it's so challenging. Like, for example, if you go to any, conversation about the value assessment, talking about equity, one of the key question that, somebody gonna bring it up is, who gonna pay for, the equity? You can see that because we have different type of the disparities, right? So that is a legitimate questions. So that is a key question that is still challenging, but I think that it should be a way, to balance between the efficiency and equity. That's my view. I don't know where is that, but that is my work thought. I got a lot of supports, directly or indirectly from PhRMA Foundation. Through PhRMA Foundation, I also have built a network. When I got the award, for example, or and then my name was there would be someone in the network would send a congratulation, kind of message, or try to connect with me via LinkedIn or social media, out of the blue. And those are people that I don't know, and sometimes they are really, guru in the field. My goal is that as I said, if I can actually help, kind of narrow the gap of the disparity, just even a little bit, for people, especially people in the deep south. So that I would consider that as as my my career goal.